Good morning. Good morning. Welcome to Health is Wellness. Good morning, folks. Good morning out there in the ethos, wherever you're tuning in from today. Good morning. Good morning. You are viewing Minorities for Medical Marijuana's Health is Wellness programming. I am your hostess, Nicole Buffong. It is my honor to be here this morning with you all. I want to go ahead and get it started because we've got a lot to cover and talk about today. One of the things that we come on here and talk about is using cannabis as medicine. We know how important it is to use cannabis in many different ways. But what one good thing that we do know, or one thing that we do know through research has shown us that there are some adverse side effects. It just comes with the different people, the different body makeups that are using cannabis. And so I say it all the time, cannabis is not, the say all be all for everyone, but it has been proven to have very good therapeutic benefits. And today, in honor of National Overdose Awareness Day, which is August 31st coming up, we want to make sure that we are talking about how we use cannabis as a therapeutic medicine, because research has shown that helps with people recovering from addiction. So we want to make sure that we talk about that research and what that looks like, and then we also want to talk about, the research that shows that there's cannabis hypermesis syndrome, which is something that really is severe in patients who suffer from it. It's excessive vomiting, and it's something that's uncontrollable for them when they consume cannabis. And so we don't quite know what causes it yet, but we know that it exists. And so let's talk about it. I am so honored today to have one of the best science researchers, Dr. Jean Talleyrand, joining us today from California. Good morning, Dr. Jean. Real quick, Dr. Jean is the Chief Medical Officer of Medican and the Clinical Endocannabinoid System Consortium. He serves as the chief medical officer for both of those organizations, and we'll get into what they are in just a minute. But as a Medican clinician, he has extensive experience evaluating the therapeutic benefits and adverse events associated with cannabis use, which is what we are here today to discuss. So I would like for you to please share with our audience, Dr. Jean, how you got started in this area of research. And welcome to Health is Wellness. Thank you for being here. Oh, you're on mute. If you unmute yourself, yes. There you go. Oh, nope. There we are.
All right. Thanks, Nicole.
Yes.
Thanks for having me. Happy to be here on a Saturday morning to talk about my favorite subject. Let's see. How did I get started? Well, I have to blame, of course, my ancestors.
Yes.
How I got started on this. My grandfather is a physician, or was a physician. He's passed, and we're from Haiti, and he's been involved in not only his primary care in Haiti, but also part of developing public health systems in Haiti, and so maybe a little bit of his influence passed on through me. My father's also a physician, more of a laboratory physician. He's a pathologist, and so I grew up with discussions of autopsies at the dinner table, and uh, being brought into the lab to see specimens. Yeah, the field is. I'm comfortable in the field. But I got started. I trained in family medicine. That's so I followed, I guess, my grandfather's footsteps more than my dad's, and didn't expect to be involved in research, but uh, felt the need for it when I got involved in the cannabis industry. The and I got involved in the cannabis industry because my patients guided me to it. I of course was in San Francisco, which historically is the center of the medical cannabis movement. During the 80s here in San Francisco, as you all might remember, HIV was running rampant, and a lot of the patients felt not only they were having trouble with symptoms from the pharmaceuticals they were prescribed, but also they were desperate to ease their anxiety around an unknown disease, having trouble sleeping, just concerns in general. And cannabis sort of came in to help ease their journey through a horrible condition. And so
Yeah, we all know the history of how important the AIDS movement was to legalizing cannabis in general in California, and then that wave that happened across the country after that. Okay, so I thank you for that. Understanding a little bit about your background, how you got into this side, and I think you explained you shared a story with me that your patient came to you and explained how the medicine, how cannabis was helping more than the medicine that they were being prescribed at the time, right?
that's right. Usually when you have chronic pain patients, their first request is for more opiates. Well, when one of my patients came to me and handed over his opiates and asked instead for me to sign a medical cannabis recommendation, I did a double take, not knowing much about cannabis at the time.
Mhm, mhm, mhm.
So I said, this is something we've got to find out about.
Dig into. Yes. We're so glad that you came over to our side. We need more smart doctors like yourself that have an open mind. Like you said, you had not used cannabis. You're not a consumer. And so, but you find it as a smart individual and a researcher, scientist, really, you understand how important it is and how valuable it is to actually study the plant instead of guessing, instead of listening to wild rumors and accusations about what the plant actually does. Let's have the research and science to back up and say no. This is what it actually does. So thank you for that. I'm glad you came over to our side. But could you explain to us a little bit more what in our audience? What is the Clinical Endocannabinoid System Consortium? What is
it's,
that?
it's two nerds getting together to come up with a name for a research organization. I I met my partner, Dr. John Abrams, who had already an extensive career in research in helping develop monoclonal antibodies and a class of medicines that are pretty popular now. And he really felt that in cannabis there might be a similar pathway to discovering the therapeutic benefits of cannabis. In develop antibodies are large protein molecules, and so they're very variable, different parts, and so they had to solve that problem in developing antibodies as medicine. When we started, when we started uh, the the Clinical Endocannabinoid System Consortium, we we felt that cannabis, because it had multiple agents, multiple active ingredients. The plant has hundreds of active
Right,
chemicals.
compounds.
It
Yes.
it
Mhm.
may behave similarly to the large protein molecules, and so anyway, there was something about cannabis that really was similar to antibodies, and so we decided to sort of use a similar approach to try to characterize and categorize the plant based on what John knew in the past.
And so the job of your research team, you have many, right? I really am excited about learning more about the you as the co-principal investigator for the dosing project, right? It is the dosing project is an observational study of community accessible cannabis products. Yes, let's break it down. Let's really talk about, because now you go into a dispensary and you know what it all of the things that you all the options that you have, all the products that you have a choice from, how does that correspond with your endocannabinoid system, right? And I know that a lot of people who follow our programming probably have heard me say the endocannabinoid system before, but there might be some new people on today, and I want to make sure that we kind of give us a brief overview of what the endocannabinoid system is so that people can relate it to how it relates to the cannabis plant for me.
So it's a relatively new system. It just, we've always known about cannabinoids. So that's the root word, right? And those are the active constituents of the plant. And what we didn't know back in the 80s is that these cannabinoids were attaching to specific receptors. And if you see on your screen, the receptors are called CB1 and CB2. So the cannabinoids were attaching on those receptors and affecting multiple organs throughout the body. And if you see again on your screen, everything from the brain to the kidneys, the uterus, bone, intestines, I mean, everywhere were these receptors. And so we thought, well, this is a pretty important thing. The term endocannabinoid system sort of came about because we saw that the body already had a system that used these receptors. These receptors were not around just for cannabis. So, that we were producing things called endocannabinoids, internal chemicals that are similar to what's found in cannabis. And those chemicals were attaching to the receptors and creating a balance, a homeostasis with our internal system. And so
That's right.
uh, and so
And,
that's where the endocannabinoid system came about. Yeah.
yeah, and while the cannabis plant was being researched in Israel, right, with some American scientists and some Israeli research scientists digging
Dr.
around the
Machula.
plant. Yeah, digging in the plant, trying to find THC, trying to understand CBG and CBD, these phytocannabinoids they discovered, and they come across this system in the body that corresponds to these phytocannabinoids,
Yeah,
right?
the system's really interesting
Yeah,
because it sits between different concepts. The concepts of neurology, which is the study of nerves,
that's right.
and immunology, which is the study of your immune
Mhm.
system, immune cells,
Yeah.
and proteins, and the endocannabinoid system sort of communicates between those two systems in the body, and so it really was unique in that aspect. It really sort of was combining different ideas and showing that there's this balance between the different systems.
That's right. And it makes balance through all the systems in the body, which is fascinating to me.
Yeah.
By studying the endocannabinoid system, you are in fact studying the plant because it corresponds so well with the plant, right? And understanding how the plant helps to create this balance, right? And is that what the dosing project is about? Like trying to understand how you're dosing with the plant that determines the outcome of how it affects your kidneys, how it affects your immune system, how your nervous system, those kind of things.
Well, you can study the endocannabinoid system with other chemicals, and in
Like
fact,
proteins.
well, no, I mean just synthetic cannabinoids. In fact, the
Oh,
the pharmaceutical industry really had a head start. They started right away once we discovered these receptors. They were making all sorts of chemicals to see, oh, what can we use to as drugs to affect this system. What happened is that everything they were coming up with was either dangerous or not effective, and so that's where we get to the plant. because
And
the
so
plant.
is this how they came up with the patent that the United States government owns on synthetic cannabinoids?
That's an early, well, the U.S. has patented CBD, which
Yes.
is something found in the plant.
Right.
Um, and they also, many pharmaceutical companies came up with synthetic things. You know where you see the synthetic things right now?
Yes.
In the illegal markets known as K2 or spice.
Yes.
That was really started from the pharmaceutical industry. It's playing
Interesting.
around trying to figure out different chemicals. And so they created a lot of different synthetic chemicals that weren't working, but eventually made their way into legal markets and were being sold as cannabis because they were just chemicals that were made in the lab. Um,
Oh,
so yeah, that all started,
interesting.
that whole problem with synthetic, with spice and K2, which are dangerous things, and I advise people not to use those, but those are pharmaceutical derived.
Versions of the cannabis plant. Got it.
Yeah.
Okay. So what is the dosing project then?
The dosing project starts by, well, I was evaluating people using cannabis, right?
Okay.
And
Right?
my issue was, if you're using this, we need to find out how much you're using, what exactly you're using, in order to understand the different effects it was having.
Right?
And so the dosing project was a way to source data from the community so that we can see exactly what you're using rather than me making up a synthetic product in the lab. I want to know what you're actually using in the community that's creating these effects that have you come into my office and hand over your opiate prescriptions because you don't need it anymore. So what is it that you're using that's doing that? And so the dosing
That's
project aimed to figure out what you were using and how much of it you were using. That's where the dosing comes in. Because without that, we can't really understand the true effects of the plant. And so it's using community derived data to determine correct dosage from plant products. Absolutely, the plant.
and is it just the cannabis plant that you all are using in this research and study? Are you using any other entheogens, any other
We're
plant medicines right now?
just cannabis. That's complex enough. Adding another
Right.
plant in there.
It is. It is. It
Oh,
is. Right. And are you using full spectrum, as like you're just asking the public what they're using? You're not really giving anyone any medicine or anything like that, right?
we've
It's
been
just based
able to
on
do some real, and we're not giving anyone anything. No, we've
right,
been really able to figure out what folks are using based on their responses, based on them telling us, what form they're using, whether they're using a flower or they're using an edible, why they're using it, whether you're using it for anxiety or pain. We've asked them the aroma of the flower. If it is a flower that they're using, we ask them to smell it and tell us what the aroma is. That gives us some hints as to what chemicals are in there. As you mentioned, terpenes are an important part of the plant. And so
experience part of
yeah,
the medicine that you get. Yes.
yeah. And so if somebody says, "Oh, I've been using a plant that has a real gassy or fuel-like aroma," that gives
Mm-hmm.
us a hint as to which terpenes are in your
Mm-hmm.
plant,
Mm-hmm.
and then from there we can make some conclusions.
And which ones give off that skunky smell, Dr. Jean?
Well, the skunky smell is
Yes.
really probably not from the terpenes. It's
Okay.
from a group of chemicals called thiols, which are sulfur containing, think rotten egg, sulfur. That,
Okay.
that sulfur containing chemicals are probably causing that skunky
The
aroma.
actual smell. Oh,
Yeah.
okay. Not any particular terpene. Interesting. Okay.
Thiols. And we haven't even begun to talk about the thiols, right? That's
Right.
an important class of chemicals.
Right. Absolutely. Absolutely. Okay. So if someone wanted to participate in this actual research, how do they do that? Is it that can you do the research in any state? And can you, because I know I want to get involved.
It's pretty simple. If you go to our website, www.thecesc.org,
Okay.
if you go to our website, right in the front page, it says join the study. Click on that button
Oh, okay.
and register. And every
Okay.
time you're using cannabis, go in and log. It's very brief set of questions, 6 or 8 questions. Tell
Okay.
us about it. Tell us the aroma. Tell us how much you used. Tell us how well it worked. And
Okay.
that's really valuable data. The community can help move the research forward because the institutions are not always pushing that agenda. Right.
Well, and as a research scientist, I know you can speak to this in helping us to understand um what the government and what institutions, these institutions that you mentioned, are allowing people to do the research with cannabis on, right? When you apply for these research to funding, when you apply for the research certifications, if you are proving that cannabis does things right, like, maybe kill cancer cells, then you don't get funding for that research. You don't get approved for that research, but you would get approved for research that proves that cannabis, causes psychosis, right?
Right.
You get
Right.
you get funding for that real quick. You get a yes for that real quick.
Yeah, well, most of the funding for years came through the National Institute of Drug Abuse.
Right.
And their directive was to figure out how abusive is this substance, how negative is this. And so they weren't interested in how well it was working. They were interested in what are the negative effects of
Of
it. And
course.
that's where most of the funding goes. As
Mhm.
well, because researchers couldn't touch the plant, they controlled the source, and the
That's right.
source came from a very specific source grown in Tennessee or Mississippi, and that's the only medicine you can use. We don't use the medicine grown by the government. We ask the community to tell us what they're using, and so
Right.
we're really in an observational stage. But we get valuable information from what's actually being used in the community through the
And do you ask demographics of the people that are participating in the research? So do you have an idea of, whether you have people of color or, and any nationality or where they're from?
We stayed away from that at first because we wanted to minimize the number of. But yeah, we're getting into asking more demographics. Gender is important to us because biologically there may be some differences based on gender. Socially, the data that's used to describe different populations, Black African American population, Latino X, sometimes that data can be taken and twisted in a negative fashion. And so at some point we hope to get data that's like that. But at first we really wanted to stay clear of the politics and really just get to the biology.
Of
Uh,
it, yes, of how it affects humans, all of us as a
correct.
group, right? Um,
We're mostly all the same. Our
yeah,
DNA
right.
is 99+% the same, right? So
So is your amount of melanin in that 1% DNA? Because I know that makes the difference, right?
well,
Um,
yeah, melanin is important in a lot of
Yeah,
social.
absolutely.
Yeah.
Absolutely. Okay, so with this research, are you what about I know you said that you asked the question, what are you using it for in
Hmm.
particular? Are you asking any other health questions? Probably not in 6 to 8 questions. I don't know. But are you getting an idea of the tracking the conditions and what people are using it for?
I do that when I have one-on-one visits with patients. That's important to get a full medical history so
Because
that
you're still a clinician. You still see
yeah,
patients. Yes,
yeah,
right.
yeah.
Hmm.
So that's a major part of the time I spent during the day, guiding patients on using this herb, this plant that has multiple ingredients is very interesting. You really have to start, thinking about multi-agent pharmacology and things like synergy. When two chemicals come, they're not necessarily the sum of the parts, right?
Right.
Sometimes they
It's
can,
what happens when they come together. That's
yeah,
that
yeah,
ensemble effect. We've talked about
yeah,
that here before.
yeah.
I've heard the Knox doctors say that name instead of the entourage effect, because the entourage effects gives you the idea that there's a leader and you're following the leader, and an ensemble is every part is just as important to get to get that beautiful sound, right?
That's
Um,
right.
And so that's the difference there, because not one chemical in this found in this plant is more important than another. It's when they come together. So want to kind of get to this study that I found. Let's talk about. We know the therapeutic effects. We know how those work, but I know in your research you've also found some adverse events, right? You've also found things that come up that are you're not familiar with, and you're trying to understand. Like, okay, um, new diseases that come around cannabis and cannabis use. So we've
Mm.
heard of cannabis abuse disorder, but I found a new study that shows that using cannabis products to treat pain, anxiety, and depression failed to improve these symptoms while doubling the risk of developing the addictive symptoms of cannabis use disorder. This is a term that I've heard with veteran advocates that are working with a lot of veterans and trying to get veterans safe access to medicine. Is that they are being labeled with cannabis use disorder when they tell their doctors that they're just using cannabis instead of the opioids that were prescribed to them. And so when I hear this, my flag goes up, because as an advocate, I'm thinking, this is reefer madness, recycled, right? This is propaganda coming from we know who, those big actors in this space. You mentioned them earlier. We all know that they are already in this space. Creating synthetic cannabinoids is their jam. That's their thing. They know that that's where they can make the most money and impact. Stop. Sorry. So puppies. But what I want to know is, what has your research found about cannabis use disorder? And contrary to evidence-based medicine, this is what the study says, that people with medical marijuana cards choose their own products and dosing, suggesting the need for better controls over dispensing, use, and professional follow-up for these patients. That's what this research proves. So when I first read the first paragraph, I was like, this sounds like reefer madness. But when I read the second paragraph, I said, okay, this makes sense. Yes, there's nobody that's talking. The bud tenders who might not have a lot of knowledge about the plant are being asked questions that they can't answer by patients, right? And so they were absolutely right in making this suggestion at the bottom there. That second paragraph saved them, and made me read the rest of the article, the research. But what are your thoughts on this, Dr. Jean? What have you seen when it comes to labeling patients with cannabis use disorder, or your research with cannabis hypermesis syndrome?
Whenever you look at a study, having read so many studies, I always go now straight to the bottom, the end of the study, to see who funded it. And it's interesting that the study that you quoted was funded by NIDA, National Institute of Drug Abuse. And secondly, that the principal investigators had financial relationships with Pfizer. So that was
Follow
very
the
important.
money, in the words of Rico Levine. Follow the money.
That's right. That's right. Yeah, yeah, exactly. Yeah, those are words to live by, especially in this kind of economy. Yes, follow the money. So absolutely. So that wasn't important to know. But you're right. I had the same. I like the conclusion. I thought, well, we've also got to talk about cannabis use disorder.
Because that's a real thing, right? There are some people who that can affect, but they could also have alcohol abuse disorder. They could also have food abuse disorder. Like, it doesn't single to just cannabis. But of
Yeah,
course,
I don't know why they added there's a diagnosis called substance use disorder,
got
which
it.
has its own language, and it
Right.
talks about the idea of addiction, and that it's not really about the substance so much as that your reaction to the substance. Somebody can have a drink and be fine, and somebody can have a drink and need a few more and then be compelled to keep doing it until their life gets destroyed. That's addiction. When your life is getting destroyed from your inability to control the use of any substance, then that's addiction.
That's right.
That's
And it can
and
be to
so
anything. Right.
Yes.
Yeah,
And so
exactly.
I would rather label people who are using cannabis, where this is happening to, as substance use disorders, because that's where we put people who are using alcohol. Uh, why not? Why do we have to have a separate diagnosis for cannabis use disorder? When you compare the two diagnoses and their criteria, because a lot of these diagnoses have these lists of criteria that you follow, you start seeing things like um, tolerance to cannabis. Well, there's tolerance to any pharmaceutical that you use. That's the nature of using something every day. You're going to get tolerance to it. And in fact, in a lot of our medical books, there's this concept of taking a drug holiday from the prescription medicines that you're using because you want to make sure that you're having a significant effect from that. So tolerance is normal, but when you're listing tolerance as a problem, then that really sort of overdiagnoses a use disorder. It's interesting that cannabis use disorder used to be called cannabis abuse disorder, and they changed it to cannabis use
Use
disorder
disorder.
because there's was pushback that it's not really being abused. And so
Mm.
this study measured cannabis use disorder. The problem with the study is most people dropped out of the study, so that there was something about the study that made them say, "I don't want to do this anymore," and and that there was an overdiagnosis of cannabis use disorder because they were comparing a group of people who had access to cannabis versus a group of people who didn't. And when you have access to cannabis, you're going to use it. And when you use it, you're going to build tolerance. And when you stop using it, you're going to get withdrawal symptoms. That's with any substance. And so that's important to note. Yes, is it going to negatively affect your life? The study didn't show that. It showed that actually most of the people had minimal cannabis use disorder, which means that they were just getting tolerant to the plant that they were using. Their conclusion, though, as you said, was very important that we need to follow these folks because this is a product that is supposedly helping, and it seems like it is helping the general population. So we need to follow how they're using what they're using, getting the dose. That's what the dosing project's all about. So here for that.
And it's important part of the research, right?
Mm.
You gotta, it can't be just one time you ask people, like you said, you as every time you consume, you should be logging on to their website to fill out the questions, the questionnaire, to help with this research. That's how you can help and be a part of it. It's important to understand, like, make it part of your routine every time you medicate.
Yes. Yes.
um
We want answers from the community rather than the researchers telling us
what it
what's
is,
going
right?
on, right?
Yeah,
Let's get the data
let's
from
get the
what's
real data.
actually happening.
That's right. That's right. So we have a really great question here, Dr. Jana, that I'll read to you. Have you done any work with MS? Because this particular question is from a patient currently dealing with MS, and she's heard about medical marijuana, maybe being able to have some effects on helping to manage it. I think that's the question that she's asking, and she's looking for if there's any information about a protocol, a dosing protocol. Are you familiar with what you tell your patients? Maybe you can share with us today. Yeah, what you recommend to your patients when it comes to dosing. And let's start with first. Let's start, Valerie. Let's start with the different ways of consuming cannabis, right?
Mm.
Let's talk about our different methods, and then I
Mhm.
think we can get into, if you can give us a brief overview of that, the different methods of consumption, and then what would be the dosing recommendations for those methods.
Yeah, I mean, most people got their knowledge these days about cannabis from the movies and Cheech and Chong and rolling that joint or rolling that blunt from Friday and get getting uh, that's how. So inhalation is what a lot of people are doing because that's how they were introduced to the plant. But traditionally, cannabis has been used for ages, and inhalation has always been a method. However, ingesting is a very old method and has been documented, you know, earlier than, as early as the 1400s, earlier than that, it's been ingested. You can rub it on your skin. You don't have to put it internally. And so you don't have to worry about the psychoactive effects that way. So you can inhale, you can ingest, eat it, and you can rub it on your skin. Those are the three basic categories of how you can take it.
And
Uh,
and so if you did a suppository, what
mhm.
method would that be considered? Topical, I guess.
I use, because it's all going through the GI tract,
Yeah,
through the
that would be,
gastrointestinal tract.
yeah.
I would consider it closer to ingestion, but we can give it its own separate category.
Yeah, that's
Rectal,
another method. Yeah, right.
yeah.
And so the Valerie had a follow-up question to that, to asking about the different dosing. Is there a way, like, what do you recommend how to dose with these different items? I mean, it just depends on the individual. That's usually what I tell people. But she also had a question specifically about the cognitive decline that MS causes. If you have any research that shows that cannabis may be able to help with that, what's your response? Yeah.
I don't personally have,
Yeah.
in terms of dosing, it's explorative right now. So a patient
Mhm,
comes in, I say, well, have you used it? If they haven't used it, I give
mhm,
them a basic
mhm,
introduction into
mhm,
the dominant cannabinoids,
mhm,
THC and
mhm,
CBD,
mhm,
and also letting them know that there are other classes of chemicals that it will influence the effect of THC or CBD, like
mhm.
terpenes, like the thiols, maybe, like the esters, maybe. So there are different chemical classes in the plant,
Of
but you categorize first THC, CBD, or you're blending the two, to see how you're doing it. So that's how you approach it. How are you going to use it? Route of administration, what you're going to use, what dosage you're going to use, what product, whether it's THC or CBD or both. And then in regards to MS, there has been some studies with MS. The studies were done by one of the first pharmaceutical companies to actually produce plant-derived product containing THC. Now they stripped everything else out. They put THC in some oil. They combined it with CBD in a 1-to-1 ratio, and they put it in the oil, and they called it Sativex. And that was produced by a company called GW Pharmaceuticals. And then they did studies with that to see if it would help patients with MS and pain. And they did find that it did help with their perceived pain, but it didn't seem to help with the other things regarding MS, which MS
cognitive,
folks,
it's a lot. It's an autoimmune, considered an autoimmune, so it
yeah,
affects a lot of systems.
the endocannabinoid system, or THC and CBD, both have anti-inflammatory effects. We've seen
Properties.
that on animals. We've seen that,
Mhm,
on cells.
mhm,
I'm curious whether um, we can take an anti-inflammatory approach to MS, to see
mm,
whether. So I usually recommend for folks who are trying to explore is an old method that we found used in Jamaica. We found it used in certain countries in Europe, where you take the flower and you boil it in water 20
yes,
minutes, and
yes.
then you pull the flower out and you drink the
Like the
water.
water,
Yeah,
yes.
and
Yeah,
we
yeah.
studied. You know that method?
Oh, of course.
Uh,
Like, so you're speaking my language, my love language now. I'm always talking about, because I'm familiar with that method, because I'm familiar with the way Rastafarians make
mm,
tea.
mhm,
And that's what they give to women, pregnant women, usually. Instead of smoking it, they get the tea, or something that they've made that they digest, versus smoking. And so it's my grandmother used to soak cannabis flower inside of rum. It sat
mm.
in the back of the liquor cabinet. And I remember it as a child. Once I started getting into this, I can remember vividly, like when you start getting a cough or the sniffles, you would get a tablespoon of this stuff. And, and it would
Interesting.
knock out whatever was going on, in your body. But next morning you were just fine. You were up playing around. And so, and asking her later about those herbs in that bottle and where they came from, and she would just call them bush herbs. And so, yeah, I'm very familiar with that method. It's something that I utilize a lot, because with HIV, the inflammation that causes the virus to kind of flare up, me avoiding inflammatory foods. And that's another thing that I want to share with you when it comes to dealing with an autoimmune like MS, Sister Valerie, is making sure that you are on an anti-inflammatory diet. That's just going to help even
Mhm.
your body even more help your to fight off the symptoms, to manage the symptoms the best way that you can, because we're not talking about cannabis being the cure, right? We're talking about you being able to manage your symptoms better off of these harmful medications that have all these other side effects. Let's look at a more natural way to kind of manage your pain, manage your cognitive, manage the levels that you're feeling with those symptoms. So one more question, Dr. John. The medical cannabis programs are really being cannibalized here in the United States by adult use programs that are moving in, right? But none of these states have gone just adult use straight out the box. Everybody starts with medical and then they gradually get into adult use, but they really are being destroyed. How can we protect our medical programs? What is your recommendation for that?
Yeah, when it happened in California, I voted against it. I might have a twisted perspective as a physician. To me, all use is medical.
I
if
say it all the time.
if you need to relax from a heavy day of work, I think that's a healthy approach to life, to relax after a stressful
Absolutely.
time. I think
Absolutely.
that, yeah.
If you want to enjoy a hike, or and paint a picture, all of those, using the plant helps to open up those parts of your brain. And so I feel like
Creativity. Yeah.
yeah, I feel like that is a medical use, right? It's all medical.
Right, right.
And whatever you think you're using it for, if it's to go out and have a good time, you listen to the music just hits you different when that medicine is in you.
Right. Recreation is a medical. As long as you're not. Now, we're used to, in our society, going out and having a good time and starting to drink. Now,
Right.
when you're starting to drink, you're putting poison in your body, right?
That's right.
But
Facts.
think about going out with some water and some cannabis and
It's a
enjoying your
different
time.
experience. That's right. It's
Yeah,
not going to be any fighting.
right. Exactly.
There's not going to be any arguing. There's probably going to be destroying of a lot of late night pizza, but that's about it.
That's happening in either way.
Exactly. But when we're talking about our different autoimmunes, next month we're going to have our health is wellness week, and it's sickle cell awareness month. Shout out to Brian McCarthy, he leads our medical safe access program, and so he is a sickle cell survivor. And one of the reasons that cannabis can also help with sickle cell, I'm sure that you've had some research that proves that. How does it help manage the symptoms from sickle cell, real quick, because we don't have too much longer, but I want you to just kind of give us an idea about that.
Well, pain, inflammation, that's really the issue with sickle cell. I don't know if the actual vasodilation, so sickle cells are these abnormally shaped cells that kind of get stuck as they run through your body. If we can open up our blood vessels, does that mean that they get stuck less? I don't know. So those are the questions we've got to solve. I know there's been some efforts into sickle cell and cannabis beyond just reducing the pain. But a lot of people with sickle cell that I have treated ended up on opiates chronically, and being on opiates is every day is a dangerous
path. It is a slippery slope. And so Dr. John, again, I want to thank you so much for being here with us today. Make sure we run our website again across the screen, folks. Every time you go to medicate, you need to go to this website and do the research, fill out the questionnaire. This is an ongoing project. We are the best research, y'all. I say this all the time. One size shoe doesn't fit everyone. So if you help us gather this information, that's how you can be a part of helping to get the truth out there about cannabis and its therapeutic uses. If you're experiencing symptoms of cannabis hypermesis, we didn't really dig into that too much. Or if you feel like if somebody has tried to label you with cannabis use disorder, fill out this form. Help us with the research. Every time you go to Medicate. I stopped calling it smoking years ago. I had been calling it Medicate, medicate for years now, because it's important what we call it and how we refer to it, right? How we
Absolutely.
refer to this medicine, this plant medicine, because it really is it has saved my life. Hey Sherelle, I see countless other people here that have been joining us today, whose lives it has also saved. And even the curious ones like Miss Valerie coming on and asking the right questions. Yes, we want to tell you that I have seen over and over again with lupus, with MS, with sickle cell, all of the people that it has helped get off of opioids, that this
Yeah.
plant has helped get off of opioids safely. And my mom included. I know she doesn't mind me saying that. My mom was on pain medicine because she needs both of her knees replaced. And
Mm.
so I replaced her opioid medicine with topical and CBD oil,
There you go.
subliminally, and she is off of her pain medicine. No more
Yeah.
opioids.
Yeah.
And so I've seen it and witnessed it with my own eyes, and so I know that we can be a great help to you. All of you listening out here, please send your information. Make sure you share this video, share this website. I'm going to tweet that out later. But Dr. Jean, is there any other thing that you'd like to share with our audience before we go?
I would like to say that everyone needs to continue listening to your show, because you're a great advocate for the real reason we're in this industry. It's
Oh,
yes, this is really important, and you're promoting it in the right way.
oh,
So
thank
keep doing
you.
what you do.
Thank you. Well, shout out to, I can't do it alone. Shout out to Stan. Hey, Stan. He does our Sow the Land programming. He's going to be helping me with Health is Wellness next month for our Health is Wellness Week. Thank you so much, Dr. Jean, for being here with us today. Folks, visit the CESC.org. The CESC.org. That stands for Cannabis Endocannabinoids.
Clinical Endocannabinoid System
I'm
Consortium.
sorry.
You don't have to memorize
All the
it.
way up.
Just
All you got to remember is
CESC.
the CESC, y'all. Come on, .org. Join. Make sure every time you put it in your phone, make sure it's saved as one of your favorite links. So every time you go to medicate, make sure that you pick that up. You fill out those few questions, because it's going to help tremendously with this research. Dr. Jean, thank you for all that you do. I will see you on High at 9 here coming up this week. We are on a weekly news program called High at 9. You can join us on Clubhouse. We are at 9 a.m. Pacific time, Monday through Friday. Shout out to Rico and Jason and all of our family there. Love you so much, Sherelle. Thank you for joining us today. Thank you everyone for joining us today. Roz in the background holding it down for me. We love you all. Thank you for joining and attending today. We will see you very soon. Stay tuned for Stanley. He will be hosting the Sow the Land. If you want to learn more about hemp as a commodity, as construction, all of those things, please tune in. Coming up at 1 p.m. Eastern Standard Time, 11 a.m. Here on the West Coast. I'm sorry, 10 a.m. here on the West Coast. We love you guys. Thanks again. See you next week. Next month. Health is Wellness week is going to be September, kicking off September 25th. Join us, y'all. Last week of September. Can't wait to see you.